Hello everyone, my name is Ruby Edit and I'll be presenting my program plan online presentation. And the topic of this presentation will be developing online workshop for community health staff on prompt responsiveness in COVID-19 pandemic, promoting best practices. This program will be located online and assessed online. It is an online workshop targeting community health center, frontline community healthcare workers in those community health centers. And it's a 2-day, 2-session, 3-hour per session program that will be going on. Program. The learning theory of pragmatism is what I'm using to inform my program plan, and I chose this learning theory primarily because it's practical and experiential learning in its approaches. It actually focuses on real-life experiences and applies the lessons learned in real-life situations. This learning theory also considers the lived experience of participants working in the community and how conversations and interactions between the participants can support the learning. The program goals. So my goal statement is to ensure effective capacity building on prompt responsiveness and preparedness for community workers in the 6 community health organizations in Ottawa during the COVID-19 global pandemic. My program objectives. Number 1 is to offer online synchronous and asynchronous workshop to serve 6 community health centers serving Ottawa communities. Number 2 is to ensure that 85% or more of the community health center staff who enrolled in the workshop can practice responsive service provision for clients and communities that are served by these centers. And number 3, to ensure that all participants demonstrate the importance of responsiveness in tackling COVID-19 and understand clients' potential needs by achieving 85% or higher in the post-tests given at the end of the workshop. So the learning objectives, and I'm going to be addressing program objective number 1. So after the workshop, the participants will be able to promptly identify community member needs for services using a checklist that will be generated at the end of the workshop. Participants will also be able to effectively triage, categorize clients based on their health needs and presenting symptoms after community of practice sessions, where they will be able to share best practices and see what is commonly seen across the communities in Ottawa. Participants will also be able to be prepared to respond appropriately to identify community needs, using referral forms and being able to cascade these needs and make appropriate referrals. The instructional plan. So for the 2-day course, we're going to be having the following learning objectives, which is to define the concept of prompt responsiveness in a fast-paced, evolving pandemic. The COVID-19 has changed the way service provision is being conducted, and we would like to prepare the healthcare workers to be able to define what that means and to recognize the needs of the community during community engagement, to also be able to describe the barriers and needs to health access identified by the community that actually drive the spread of COVID-19, to demonstrate rapid responsiveness to identified community needs, to analyze case studies of challenges and barriers across the different communities that are affecting health access in the pandemic, and to evaluate the importance of the concept of prompt responsiveness in a fast-paced evolving pandemic. Furthermore, to develop and design approaches to use all components of the prompt responsive framework in their daily work activity. For the transfer of learning plans, the teaching model is an online synchronous and asynchronous method to ensure that participants are actively engaged and real-time live discussions and conversations and interactions can actually occur between participants and instructors. In addition, it stimulates self-directed learning as participants can take home learning activities and assignments within the period of the 2 days. Participants can also use program content for future use. The length of the workshop will be 2 sessions for each day of the 2 days, and this will be organized into modules. The instructional techniques to support effective learning will include videos, lectures, audio, small and large group activities, and the creation of group concept maps on prompt responsiveness at the end of the workshop. Technique 1, Individual Plan Action. So within the individual action plans, each participant will define the appropriate outcomes, the steps to achieving them as a result of the training program, and this will highlight the drivers and the barriers of achieving transfer of learning from the experts. Technique 2, use of visual aids. Digital copy of course materials and information such as written checklists, chats, work samples, videotapes, websites, web links, other resources that are online, and digital copies of the produced group concept map of each group will be provided for the participants to have as resources for continuous capacity building as they continue to tackle community needs and address community needs in their daily work. Technique 3, focus groups. So a group of participants will be grouped together during the workshop to share best practices, experiences, lessons learned, and transfer their individual community health organizations learnings amongst each other. This represents a professional learning community that will be established or a community of practice that will hopefully continue after the workshop. My evaluation plans. The purpose of evaluation is to assess the knowledge gap of the community health professionals, to collect and collate best practices and lessons learned, and assess the effectiveness of training for these participants. The results will be used to establish a training curriculum on rapid response to the community needs in COVID-19 pandemic and design a program with tools supporting implementable strategies for community healthcare professionals. So the techniques for collecting data for evaluation, we're going to be using the pre and post tests. These are a quantitative test type. At the start of the workshop, a pre-test will be done, and a post-test for summative assessment will be done at the end of the workshop, and both will be compared to see and assess for participants' growth in knowledge. So generally, questionnaires will be used, provided through a web link, and the success criteria will be 85% or more in short, true, and false assessments. The evaluation generated will be used to assess the success of the instructional technique. And this technique, we're saying its effectiveness in facilitating learning for the participants. In addition, this process will reveal if the instructional plan has produced the desired outcomes and if the learning objectives for learners has been achieved. The second technique will be the performance review, which is mixed quantitative and qualitative summative technique. And this technique will require observation and interpretation of the discussion and demonstration activities that will go on during the workshop. The focus group discussion between participants and instructor involves instructor prompting participants with open-ended questions while recording and observing the sharing of experiences, the nuances, all forms of communication that go on through this focus group discussion will be taken into consideration, and the best practices that have been used to tackle and address issues that have been consistent in communities during the pandemic. This data will be used to create a checklist to rank identified needs and to collate the most effective methods of addressing these needs based on the community health professionals' experiences. Then a concept mapping rubric will be used to determine the group's overall performance by the expert or instructor providing a summative assessment. The third technique will be survey, and this is a quantitative evaluation of the workshop program. This online instructional workshop session will evaluate the program content, process, and resources. A survey will be applied at the end of the workshop program to determine the participants' evaluation of resources and techniques and the effect on their learning. How much were they able to absorb through this workshop? This evaluation method aims to collect information on how to improve the instructional program as a whole. It will provide data for the overall program. The results will be used to evaluate the whole program to know how learners want to be taught and how they view the program content. It will be used to identify the most helpful learning activities and how subsequently improvement can be made on these. So for the pre and post test, this will be used to assess the preparedness and performance of participants, and this test will cover the critical topics that the workshop is generally seeking to address. The pre-test will be used to assess the knowledge gaps and challenges of participants, as they are usually not expected to know all the answers. However, the post-test is also done at the end of the training in a similar fashion with similar questions. And it's expected at this time that students would have had an increased knowledge and understanding of the subject and perhaps hopefully have achieved all of their learning objectives. Finally, my personal reflection. And for me, the most important part of this program planning has been understanding and learning about how to conduct a good need analysis. Understanding and conducting a need analysis has benefited my skills and approaches to identifying knowledge and skills gap, which helps to develop a more proactive approach rather than a reactive one. It has helped me plan training using accurate data while prioritizing the critical issues that have been identified and ranking them appropriately for addressing and tackling. All of this can be done using training, capacity building, and mentoring approaches. Conducting a needs analysis helps to determine who needs training, the knowledge gap amongst participants, how best to provide this training, and identify the best means of assessing this training at the end of it and its impact on the learners. Overall, it has allowed for design and implementation of context-specific training. And this has been my greatest takeaway, to understand that a training can be tailored to provide exactly what the participants need and addressing exactly where the participants have a deficit in knowledge. Thank you.